everyone, and welcome to today's webinar presentation entitled Raising the Age Nicotine-Free Youth. My name is Selena Degano, and I'm a Senior Program Specialist here at Public Health Ontario, and I have the pleasure of moderating today's session. Before we move forward with the presentation, we would like to first respectfully acknowledge that we are all participating today on traditional lands of many nations, which have inhabited from the beginning. As settlers, we're grateful for the opportunity to live and meet here, and we thank all generations of people who have taken care of this land for thousands of years. I would like to acknowledge that today I'm participating from Toronto on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis people. Please join me in acknowledgement and respect of all Indigenous people, their life journeys, and worldviews. We would also like to respectfully acknowledge that any reference to tobacco in today's presentation refers to commercial tobacco, which is not associated with the sacred and traditional uses of tobacco, which Indigenous peoples have been using for thousands of years. Traditional or sacred tobacco differs from commercial tobacco, both in the way that it is harvested and the way it is used in ceremony and prayer, often for healing and purifying. So it is my pleasure today to introduce the speakers for today's event, Dr. Lesley James, Dr. Rob Schwartz, and Dr. Michael Chaiton. Dr. Lesley James is Director of Health Policy and Systems at the Heart and Stroke and Adjunct Assistant Professor at Western University. With nearly 20 years of experience in tobacco control, she has been instrumental in advancing key public health policy, including plain packaging, health warnings, and vape regulations. Next, we have Dr. Rob Schwartz, is Executive Director of the Ontario Tobacco Research Unit, Professor at the Dalla Lana School of Public Health, and Senior Scientist at CAMH. His research and teaching center on public health policy, program evaluation, and tobacco control. And last but not least, we have Dr. Michael Chaiton. He is the Director of Research at the Ontario Tobacco Research Unit, an independent scientist at CAMH, and Associate Professor at Dalla Lana School of Public Health at the University of Toronto. His work focuses on the impact of tobacco policies on smoking cessation and the development of related health conditions. So at this point, I'm going to pass it over to Lesley to get started on our presentation today.
Great, thank you. Good morning, everyone. It's so nice to be here. I'm going to apologize for drinking my coffee along the way. It's still pretty early, so I'm going to need to caffeinate as we move forward. But I'm really excited to talk to you about some really important tobacco and nicotine policies that we can consider in Ontario and across Canada. So to start, what is tobacco, or T21? So that simply is raising the legal age of purchase to 21. You could also have T25, T27, whatever threshold you're proposing, but typically 21 is what we're seeing kind of mobilize around the world. A tobacco-free generation extends from that, and it would be policies that prohibit the sale of tobacco to people born after a certain year. So the simplest way of doing that is creating a law that restricts someone from buying tobacco products with a certain calendar date, so January 1st, 2005. To make it a tobacco-free generation, that law would then increase the legal age of purchase each year, so therefore a whole generation of young people would never be able to buy tobacco products. So the purpose of T21 is really that we know from the research that most tobacco users start smoking or using tobacco before the age of 20. So raising the legal age of purchase to 21 makes it more challenging for them to start. There's also some laws, but most of the laws prohibit the sale of tobacco at 21. There are some laws somewhere around the world that make it illegal for people to possess tobacco. So that's kind of an extension of T21. For this purpose, we'll talk mostly about the retail setting and the sales. T21 laws really establish a new social and legal norm. So you are less likely to see people under the age of 21 using tobacco products. And overall, it really makes it difficult for teenagers to be able to buy tobacco. from their peer groups, from people in their social networks, and makes it more difficult for them to fake the age of 21 or whatever it might be to be able to purchase these products. Some of the benefits of T21 policies protects people from ever starting to smoke. It defers the age of initiation. And we know that people who start smoking earlier in life have a harder time quitting. So if we can push this back, it makes it easier for people to quit if they ever do start. We also know that nicotine can stunt brain development. There are a lot of other, of course, implications of tobacco use, but if we're referring to vaping and tobacco, nicotine is very harmful. Our brains aren't fully developed until our mid-20s, so if we can push back any initiation or prevent nicotine use, it'd be quite beneficial to people's development. So if we look at where we are across Canada right now, there's Ontario with the age of 19 for legal purchase. You'll see to the far right, we have PEI, our shining star, with the age of 21. This is for both vape and tobacco purchasing. We mostly have 19. There are a few provinces that have 18. I do want to call out Saskatchewan. So Saskatchewan had the age of 18 for most of the past few decades. They recently raised to age 19 to align with other provinces. This is quite demonstrating a leadership role because if you see beside, Alberta and Manitoba are both 18. So raising to 19 was quite surprising for Saskatchewan, and we want to applaud them for their leadership in that space. Hopefully we can move this to 21 going forward, and hopefully the rest of Canada can reach where PEI is also. So if we look at age-based tobacco policies around the world, age 21 is becoming more common. There's about 11 jurisdictions around the world where age 21 has happened. This started in the mid-2000s with Sri Lanka, and we see some other small countries following suit. The big one that I want to point out is the United States, where in 2019, there was advocacy and movement to raise the national age of purchase for tobacco to 21. Now, this follows a lot of states already mandating age 21. And the federal government saw the opportunity to standardize this across the country. So with the United States moving in that direction, there is some hope that other countries will be able to follow. I also want to highlight that Japan and Thailand have implemented age 20, so a bit higher than Canada and other countries, but not quite there at 21 yet. So this is a picture of the US when the laws passed around age 21, and this is the FDA tool that retailers use to verify people's age. So now we're going to move on to the kind of the aspirational goal, and the one that we're really excited about is the tobacco-free generation. So the purpose of these policies is to prevent an entire generation from ever using tobacco products. So it reduces the rates of tobacco use to the youngest in our society to nearly zero by restricting their access and raising the legal age of purchase each year. So to do a bit of a scan as to how this has played out, we saw Denmark consider these policies, do a lot of work in considering how a tobacco-free generation would fit within an endgame strategy. Unfortunately, legal analysis prevented it from moving forward because of some EU directives that were in place. Next, Malaysia put forth a bill to prohibit the sale of tobacco products and vapes to anyone born after January 1st, 2007. Unfortunately, this wasn't implemented because of industry lobbying. So the former Minister of Health fully admitted that the industry got in the way and prevented this bill from moving forward. Then we come to New Zealand, and this is the one that drew kind of the most attention and got a lot of publicity around the world. So they had planned to prohibit the sale of tobacco products to anyone born after January 2009. Unfortunately, this was not implemented either. A change in government meant that the new government in power really listened to the opposition from the industry and backtracked on the act. And it's unfortunate because the act also included a lot of really great endgame measures, regulating the amount of nicotine and decreasing the number of tobacco retailers in that jurisdiction. But there's a glimmer of hope. We have the United Kingdom, and the United Kingdom has twice now put forth bills to restrict the age, or sorry, to implement a tobacco-free generation. The government fell on the first try, and then the subsequent government actually picked up the act, improved it, and it has now passed the House of Commons and is now with the House of Lords. So similar to our parliament, it has to go from one chamber to the next, but there seems to be a lot of support around this, and we're all waiting with bated breath to see what happens. There has been some regional progress on tobacco-free generations. A city in Philippines in 2016 adopted generational endgame policies, but unfortunately, it was repealed after 2 years due to some industry litigation. There is one place in the world where a tobacco-free generation currently exists, and that is in Massachusetts. And the law has been faced with litigation, but thankfully the courts have upheld this. So that law still exists in Brookline, and there is a tobacco-free generation occurring as we speak. There are also some foundations of policy, so some casework and case law happening in New York, Hawaii, and California. So we could see a movement of a tobacco-free generation in those states in the near future. I want to switch over to vaping now. I talked a lot about tobacco. If you look at vaping policies around the world, most legal age of purchase is 18 in most places. Some countries have 19 years of age, and a few more have 21 years of age. And the places that have 21 years of age typically align with tobacco. So the US, Honduras, Guam, Philippines. Unfortunately, there are no nicotine-free generation proposals in the horizon. The UK proposal only includes tobacco. It doesn't include vape and nicotine products. And actually, the proposed age in that act is 18 years of age for vape products in the UK. There are a lot of other measures included in that policy, like restricting flavors, marketing, and access in other ways. But the tobacco-free generation does not apply to nicotine products in the UK proposal. I'm going to turn it over to my colleague, Dr. Rob Schwartz.
Good morning, everybody. Thank you, Lesley. That's a great overview of the age policies. And it's left to me to look at the evidence, which makes sense given where I sit. What I want to say to start off with is, from an evidence perspective, this is really a no-brainer. I am going to, very briefly show you some of the biggest pieces of evidence that we have. And I will hopefully convince you that this is an evidence-informed policy. Unlike many of the other endgame focused policies that are on the agenda, we actually have real-world evidence, at least for age 21, regarding this one. So I'm going to show you what's happened in Canada. What do we know about the effects of our current minimum age policies? The evidence from the United States, age 21, both for 18 to 20-year-olds and for younger people, the role of enforcement, and then we're going to talk about public support, both for age 21 and for tobacco-free generation. And you're going to see that all of the evidence speaks very strongly to the effectiveness of these measures and to the existence of strong public support. So starting with Canada and what we know of the effectiveness of our minimum age legislation until now. So we did a study led by Russ Callahan that looked at the impacts of our minimum age tobacco sales laws across Canada. And these showed very clearly that there were, first of all, relatively high levels of retailer compliance, that they did decrease smoking behavior in the tobacco-restricted age groups, and importantly, that they played an important role in influencing youth smoking behavior overall at the population level. So the study indicated very clearly that those people who were above age 18 or 19, depending on the province, once the minimum age legislation came into effect, there was a decrease in the prevalence of smoking. Secondly, they indicated that younger people below the age of 18 or 19, depending on the province, actually also experience a decrease in the prevalence of smoking. So what we've done until now in terms of restricting age works. Even though we were surprised at the time, there had been relatively few rigorous studies conducted to demonstrate the effectiveness of minimum age laws. As I mentioned, we also have real-world age 21 studies, and this is coming almost exclusively from the United States, where we have systematic reviews, we have state-level analysis, and we have long experience in Needham, Massachusetts from 2006 to 2010. All of the studies indicate that the raising of the age of that you can purchase tobacco or e-cigarettes in the United States causes a decrease in the prevalence of smoking. This is true, first of all, for those aged 18 to 20. And we see that in this systematic review, there was a 39% reduction in the odds of both recent smoking and current established smoking among 18 to 20-year-olds. And that in California, the Tobacco 21 resulted in 26% decrease in daily smoking among young adults aged 18 to 20. So, that's pretty strong. That's not pretty, that is very strong evidence indicating that tobacco age 21 in the United States has caused substantial decreases in the use of cigarettes for ages 18 to 20. We also have some growing evidence indicating that age 21 in the United States also decreases tobacco use in lower age groups. So we have studies done in Cleveland, Ohio, in Minnesota, and even a national study using a national study called Monitoring the Future and Nielsen retail scanner data. All of these studies indicate that age 21 has caused a decrease in smoking amongst young people who are below the minimum age. And that, as Lesley had indicated, is related to the increased difficulty of young people obtaining cigarettes through social networks, but also the likelihood that they would be sold at a retail store because now they look so much younger than the new minimum age. Yeah, enforcement. It all comes down to enforcement, and the studies are very clear that without strong enforcement, meaning primarily ensuring that retailers are not selling to those who are under the new minimum legal age, that these laws will not have great effect. So in California, for example, regarding both cigarettes and e-cigarettes, we know that compliance is very low, and I was just at the SRNT conference in New Orleans, and this was repeated in at least two sessions that I attended, that the retailer compliance is very low, and that the state or the municipalities really are doing very little to make sure that retailers comply. So the test shopping primarily. In California, 65% of cigarette users and 82% of e-cigarette users were not refused purchase of e-cigarettes, even though they were underage. Even so, this study in California indicated that about half of the young people felt that it was harder to purchase e-cigarettes and cigarettes at point of sale. So, the evidence on the real world effects is really very convincing. Um, what about policy support? Right. So if the general population is not supportive of these policies, then the policymakers will not be prone to moving forward with this legislation. Well, we actually have reasonably strong data about the support for age 21. And as we can see on the slide, globally, support is above 50% in all countries, with just a few exceptions. It's just Germany, and in Germany, it's over 40% anyhow. And then the ITC study, headed by Jeff Fong and colleagues out of Waterloo, indicated that in these four countries, Australia, Canada, England, and the United States, support ranged from 62.2% in the United States to 70.8% in Canada. So you have got 71% of Canadians supporting age 21. Come on, policymakers, what are you waiting for? In the UK, support was at 63%. And in the US, there's been consistently strong support over the years prior to the legislation there that requires now age 21. I haven't said anything so far about tobacco-free generation, or sometimes it's called smoke-free generation, or as Lesley pointed out, maybe we should be calling it nicotine-free generation. So we obviously don't have any real-world evidence about the effects of this policy, but we do have data about public support for this policy. In the UK, which hopefully is about to legislate, 63% of respondents agree with the policy change. In New Zealand, which almost got there, but then had a change of government, 75% supported a law that prevents anyone who is currently 18 or younger from ever buying cigarettes or tobacco. And in New Zealand, people supported it as a social good and viewed it as liberating rather than restrictive, which is an important message for right-leaning or conservative-leaning policymakers and governments. It's considered liberating rather than restrictive. And we have a meta-analysis of the existing literature on support for tobacco-free generation, which indicates that 54% of respondents actually support a tobacco-free generation. So I hope I've convinced you that from an evidence perspective and from public policy support perspective, this is a no-brainer. We know it works. The public is supportive of it happening. And so those who are advocates and those who are policymakers, no reason from this perspective not to move ahead and to move ahead quickly. Thank you. And now I'm going to hand it over to my colleague, Dr. Michael Chaiton.
Thanks, Rob. For any policy, in particular novel policies and policies that haven't been tried in any or many jurisdictions, a really important component of the evidence base is derived from simulation studies. And I argue that much of that evidence base that allowed the U.S. to move forward with their Tobacco 21 legislation came from a 2015 Institute of Medicine report. And this was based around a simulation study that concluded that raising the minimum tobacco sales age to 21 nationwide reduces smoking initiation over time by 25% among 15 to 17-year-olds and 15% among 18 to 20-year-olds. It estimated that over 200,000 premature deaths in the U.S. could be prevented, including 50,000 fewer deaths from lung cancer. This simulation model was, of course, done prior to much of the real-world evidence. It relied on an expert panel where they asked experts essentially sort of quantitative estimates. How much would it be a large effect, a small effect, a medium effect, and they translated that into numbers. And they their simulation found a couple of important things. I mean, one is that they suggested that it takes about a decade for the implementation of T21 to have any effect. And that they also looked at T25, so initiation of or uh, um, the difference between having a minimum age at sort of the current, what it was set, raising it to 21 or raising it to 25 years old, where there's sort of biological reasons where we'd expect that that's about the time where we sort of have the maximum impact. And what they found was that raising it from 18 or 19 to 21 had a pretty significant impact, again, over a fairly long time period. But that raising it from 21 to 25 had an impact, but it was sort of less strong. And of course, because it hasn't been tried in any jurisdictions, less certain. Since that time of that report, there have been a number of other studies that have looked at the impact of raising the age to 21. In particular, a study in Texas used a slightly different type of model. The Institute of Medicine report, in fact, used two different models called CISNET and SimSmoke, which are sort of population-based modeling. But the Whitney study used another type of study, a sort of individual-based, agent-based simulation model of smoking behavior, and particularly focused on cardiovascular disease. And they found pretty much the same level of impact in terms of effects on smoking initiation, as well as impact on cardiovascular disease. Other studies, such as one at Skinner did in Australia, found a system dynamics model, look at different endgame policies, including tobacco 21. And again, they found a consistent effect that raising the minimum age to 21 was found to have effects on smoking cessation. However, given the assumptions of the model that were, again, consistent with some of the Institute of Medicine report and other studies that where they had an assumption that it had effect on smoking initiation, but no effects on adult smoking prevalence. This same level of effect was also found in Ontario. We conducted our own study in Ontario using the SimSmoke model, or the SimSmoke model adjusted for Ontario. And we used the data from the Russ Callahan study and evaluated and found that raising the minimum age to age 21 would be expected to reduce smoking prevalence by 5.2 percentage points among young adults. That this would have, again, a significant impact just by raising the age to 21. However, it's also important to evaluate the impact of this T21 with our goal of reaching an endgame of in Canada that's defined as 5% by 2035. This image is from a study that was conducted in Singapore, and where they looked at a impact or the potential impact of a number of different policies and game policies, including T21, T25, and tobacco-free generation. And I think what's important about this study is it shows the sort of the relative potential impact. How quickly and how much can we expect out of some of these policies? And so we can see here the effect of raising the age to 25 is the green line, so the fourth line down from the top. So we can see it has an effect. In Singapore, there is an expectation that prevalence is going to rise over time, and so we see a significant impact over time. But that impact is fairly small, even for 25, and even less for the modeling that they did for T21. However, the most impactful endgame policy was a nicotine reduction. That is taking the nicotine out of cigarettes. And that's this bottom orange line, which would very quickly reduce the number of people who are smoking cigarettes and reduce it over time to extremely low levels. The second most impactful policy over the period of time was, in fact, tobacco-free generation. That's that gray line. The downside is it does take a very long time for it to be implemented over full effects, over 50 years, to have the same sort of effect that you might be able to see from a nicotine reduction strategy. But it does get us there, and in a way that is significantly more than tobacco 21 or tobacco 25. This impact, a relative impact of the difference between a T21 and a smoke-free generation has been shown in a number of different simulation models based on different sets of assumption. So Driscoll's model, working with Tony Blakely and others at the University of Melbourne, found that using their particular model, that again, they're the same basic assumptions. The denicotinization of cigarettes, taking the nicotine out, was the most impactful, most quick policy. But that smoke-free generation was able to reach the end game over time. And that other parts of the model found that T21, again, had impacts, but not to the same level as the smoke-free generation. Using this model in different populations in Australia, in New Zealand, in the Solomon Islands, came to the same levels of conclusions. So overall, then, the simulation model suggests that there is an impact of raising the minimum age to age 21. These simulation models so far have been conducted primarily still using the non-real world data that is now available, and particularly from the US. So we haven't yet incorporated the actual impacts that we've seen from the US studies. And of course, that we have no real world evidence with respect to raising the age to 25 or a smoke-free generation. So there are certainly assumptions built in particular to the age 25 or the smoke-free generation. But they're very consistent and logical assumptions based on what we know from our experience with raising the minimum age. There is also an unknown effect on equity. Some of the studies, the Australian one, for instance, found that there is a potential for minimizing differences in equity because of it would have an impact on sex-specific rates of cardiovascular disease. There are other studies that suggest that, in particular, that there may have different effects, that we don't know essentially who is going to be impacted most strongly by this policy. And finally, there's an unknown effect on social perception of tobacco and effect on cessation. As Lesley talked about earlier, one of the important things about both age T21, T25, and in particular smoke-free generation is that it changes the perception of the legality of tobacco. And that may have impacts beyond the effect of initiation. And this is important from a perspective of compliance. When we might move to a system of T21 or T25 or a particular smoke-free generation, we're really changing how we think about the sale of tobacco. And we need systems that will allow us to have compliance and for them to have an effect, really change the way that tobacco is sold. That studies have found that in the US, that less than 20% of people who do smoke, only 20% of youth, so they actually have issues with purchasing cigarettes underage. And we've also found that this is most urgently an issue for vulnerable populations, that non-Hispanic whites in the US are those where tend to live in areas where they have more effective compliance and enforcement regimes compared to people who don't live in sort of non-Hispanic white areas. So with that, I will turn it back to Lesley.
Thanks very much. So how do we go forward? So Michael and Rob have given us a wealth of evidence and rationale as to why these policies make sense. And I'm excited to show you where we're headed. So the Alliance for a Tobacco-Free Ontario, that is our coalition of organizations that work together in tobacco and nicotine control. Many of you have seen this already, but this is our roadmap to help guide us over the next 10 years or so. These are the specific policies that we are advocating for. I also want to say that we are supplementing this by asking that 6% of the tobacco litigation settlement in Ontario be reinvested into the Smoke-Free Ontario strategy. So recognizing that we really need a boost in that strategy to expand, modernize, and strengthen it. But the first piece that we're working on is restricting access to nicotine by age over time. So raising the legal age of purchase to 21 for vape and tobacco products. And after that is implemented, we can look to a tobacco and nicotine-free generation. There are other pieces of this strategy. I'm not going to go into to details, but this will be available for you to see later. So what's happened in terms of advocacy in this space? So my organization, Heart and Stroke, along with our partners, we've been advocating for T21 and V21, Vape 21 at provincial and federal levels for some time now. There is some momentum federally. We've had conversations with the federal government about this, and given that they have an endgame target of 5 by 2035, there is a possibility of this fitting within an endgame strategy. And there's some pockets of interest regionally that we'll go through. Thankfully, there is strong leadership in Ontario, and we will leverage this as a coalition to build political support across elected officials. So the Balancing Act, a report put forth by Dr. Kieran Moore, outlined that in order to address tobacco and vaping, there's a recommendation for raising the legal age of purchase to 21, and then considering to increase the legal purchase age over time to protect the future generation. So we have it right there in Dr. Moore's report. This is a good recommendation and something he endorses, and hopefully we can leverage that going forward. So what happens going forward with advocacy? Well, we're really happy right now that Heart and Stroke will be funding Dr. Rob and Dr. Michael's modeling and simulation efforts to determine what T21, T25, and tobacco-free generation, as well as vaping, would do in each province and nationally. And that will allow every province to do some advocacy at the local level. Then we'll also show at the federal level what the impact of these policies would be. As we said, simulation modeling is very important when a policy is new. We need decision makers to see what the trajectory would be and how beneficial it would be in the long term. I'm also really happy to say that as Rob covered off all of the public support for these policies, we have fresh off the press new polling data from our friends at the Canadian Cancer Society that showed that 81% of Canadians support raising the tobacco purchase age to 21. In all my years of polling, it's very hard to get agreement in the 80s. So this really demonstrates strong levels of support for these policies, and we'll be leveraging this going forward. We'll also expect to see some regional breakdowns, so we'll see exactly where Ontarians stand on this issue as well. For us to move these forward, we need to socialize the issues. So we need to be in the public discourse more often. We need public health professionals talking about this, supporting it, getting more people on board and comfortable with the ideas. And that's what we'll be doing over the next few years. But it's not going to be an easy task. There will obviously be opposition. And I wanted to raise a few points about the opposition that was faced in other jurisdictions, both where they've seen successes and some barriers. So in the UK right now, as they are pushing for a tobacco-free generation, the industry is lobbying for it to be watered down and asking for age 21 for tobacco instead. So this is meant to distract and to take away attention from the gold standard and the most effective policy. In Malaysia, the industry claimed that tobacco endgame policies and generation-free policies would increase illicit trade, and then young people would be able to buy cheap tobacco, and this would kind of perpetuate the epidemic. In New Zealand and Malaysia, there was a big threat of lost tobacco revenue, and that's something that's going to be worrisome to all governments because tobacco revenue is a major source of profit for the government. In the UK and Malaysia, the industry leveraging their new narrative around heated tobacco products and products that are less harmful, they lobbied for exemptions around vape products and these. And this really keeps them in business and kind of perpetuates that cycle of addiction that we're trying to overcome. In the UK, Philip Morris actually threatened to sue the government over the tobacco-free generation policy. This hasn't happened yet, but they have publicly threatened lawsuits. And then in New Zealand and UK, the industry claimed that endgame measures, including tobacco-free generations, would be so difficult to enforce that they wouldn't be worthwhile. So a few things that I wanted to point out from a practicality, implementation, and advocacy perspective. Questions that we're looking at right now: do we strive for age 21, then 25, then a tobacco-free generation, or do we jump right from 21 to tobacco-free generation? Do we need tobacco and vaping policies to align? Is it worth moving forward with just tobacco and leaving vaping as it stands? And what about other products that are harmful? So alcohol, cannabis. Do we need to utilize that spectrum of harm and create age-based restrictions for each product, or do we group them all together? The next steps for our advocacy path forward is that roadmap that I shared. We're hoping to get endorsement and support from all stakeholders, including all of you listening right now. It's really important that as we meet with elected officials, we have local representation. So of course, there are some restrictions on what everyone can do in terms of advocacy, but if you know somebody who's interested and willing to champion this, please be in touch with us. We'd love to engage volunteers and powerful stakeholders in our advocacy efforts. Youth engagement is very powerful. We know from all of our tobacco control advocacy that having youth on board, having their involvement really goes a long way because they are the generation that we're trying to impact. We, of course, have a federal election coming up in April. We just had an Ontario one, and now we're having a federal one. And our course of action obviously depends on which party wins. Some parties will be more favorable to these policies than others. T21 and V21 efforts are moving forward in the advocacy space in BC, Manitoba, Ontario, Quebec, and Nova Scotia. So we have some champions in those areas really working hard to move these forward. And then we have a generational policy being considered in PEI right now. So that is being consulted through stakeholders. And PEI could again lead the way in Canada, which we're very happy to see. And with that, I will turn it back over to Selena. Thanks for everyone for listening.
Great. Thank you so much, Lesley, Rob, and Michael, for an amazing presentation. So I just want to put in a reminder, anyone who has any questions, we're going to go through as many as that we can get through in the Q&A pod at the bottom. I thought it might be good to start. Rob put a question out into the chat as Lesley was presenting about what opportunities are there for health unit staff. And Lesley, you had kind of already highlighted that there's some challenges or restrictions on what health unit staff can and can't do. So those who aren't able to kind of meet with elected officials or directly advocate, what are some potential other opportunities that they could participate in to support moving this topic area forward?
Really great question. And, we learned so much from our public health partners. We have 2 public health representatives sitting on ATFO, and they share so much insight and intel with us. And that really helps guide our advocacy and gives us kind of color to paint our evidence and our narrative when we meet with officials. So I highly encourage you to share your stories and concerns and red flags with Angela and Linda, and they will pass along that information to us. I also want to give a shout out to everyone who provided information around compliance for vaping, especially vape shops. That has really given us some very useful data to advocate with. So I think just keeping the flow of information open and accessible is very, very important. If this government does go to consultation for any of these policies, having public health units and a collective also endorse and support them is very powerful. As individuals, obviously there are some constraints, but you also have loved ones and friends and neighbors and family members who are probably very interested in this topic. And those people can be very powerful as advocates. So we'd be happy to work with those folks.
Great. And just to kind of extend that as well, there was a question that came in specifically about any specific plans for engaging youth. You mentioned youth engagement, but does ATFO or Heart and Stroke have any plans at this point of how they're going to potentially engage youth, or maybe that's the health unit?
We would love to talk to the health units. We don't have a direct connection. So, let's have conversations about ways that can happen, whether it's engaging schools or programs that are running. But yeah, it's something that we need to utilize, and we're hoping that partners can help us in that space.
Great. So just taking a bit of a shift, going back to the evidence piece. Michael, you were talking about simulation studies and the impact of the policy over a longer period of time. Were there any, did they look at any other factors? So if they implemented other policy or other interventions that helped shorten the period? I know you mentioned compliance, but was there anything else that could shorten the period in terms of when we could see impact of either smoke-free generation, tobacco-free generation, or age 21?
There were a number of studies that looked at some of the policies sort of as jointly. And certainly the modeling that came out of New Zealand particularly suggested that sort of the 3 cores of that policy, retail reduction, and denicotization of cigarettes, and smoke-free generation did work together. A number of the other studies, however, really were focused on made the assumption that it was the only policy that was happening, just to simplify the sort of the modeling effects. But certainly having a comprehensive approach does have an impact.
Great. And then another question, a bit shifting, but does anyone on the panel have any idea of why the UK didn't include nicotine and stuck specifically just to tobacco? Do any of you have any insight to
Yeah,
that?
I mean, I can address that a bit. I don't know absolutely for sure, but the context of e-cigarette use in the UK is very different than here. The UK is promoting e-cigarettes for smoking cessation. And I suspect that there would be a fear of sort of denormalizing the use of e-cigarettes, even for smoking cessation, if you included it in the increased age policies.
Mm-hmm. Yeah, I'll add to that. So remember the Public Health England report that a lot of us were frustrated by, but it really endorses vape products as a solution to the end game, a bit of a different approach. However, the UK has seen mass uptake in vaping among young people. And that's why they are following suit with restrictions on marketing and flavors, and the other things that us in Canada have been working on for quite a long time now. But yeah, it's just a different ideology in terms of harm reduction.
Great. And then kind of shifting again more into like the response from the industry. So the question is about anticipated impacts of either age 21 or tobacco-free generation, specifically on the illicit market. So that comes up quite frequently, well, across all tobacco policy. We hear from the industry about that. I'm not sure if we can speak to, or if anything has come up in the modeling or simulation studies.
We can speak. I mean, one of the important things about Tobacco 21 is actually the impact of illicit tobacco. And the real source of illicit tobacco for those in high school is a social supply. It's from people, who are a few years older, who are providing tobacco to students, and raising it that couple of years later really takes the sort of that age range out of sort of the social circles of most people in high school. So in fact, from a practical perspective, T21 has a massive impact on illicit tobacco for youth in particular. Certainly from a tobacco-free generation, we'd expect, that it will depend on how the policy is implemented and how seriously enforcement is taken. I think that the main source of illicit tobacco that we've seen from a compliance standpoint is actually those retail stores continuing to sell tobacco to people who aren't having it. This is a policy that allows cigarettes to remain in stores. And so it's unlike it's not unlike, say, denicotinization, which may have some illicit market effects. It's like these are still available through normal channels. And so the impact on the illicit market is really about compliance from the retail standpoint.
Mhm. And I would say that in the countries where the illicit trade narrative came up, smoking rates were much higher among young people too. Ours are quite low right now, thankfully. So the reliance on an illicit market would probably be a lot less for young people in Canada.
Okay, and Michael, you had mentioned in terms of the simulation models about there being a bit of a gap in terms of the impact to specific communities and or like cessation. So with, for example, PEI moving to age 21, are either you or Rob aware of like any evaluation pieces or monitoring to see like how that might be impacting cessation, like in a real world example, in Canadian, of course, it's also great.
I mean, PEI is a challenging place to study. It is,
For sure.
but we are with the Board of Heart and Stroke. We're trying to do some work, basically trying to at least evaluate sort of the impact on the differences in social norms. And I think what we've seen though from both the PEI experience and from sort of the local regulations that have come up in the U.S. is that policies that have are more broadly implemented have much stronger effects on perceptions than do local impacts. So it's hard to extrapolate again because we'd expect, really massive shifts from a sort of a national ban compared to very small shifts from more local ones.
Rob, Lesley, anything else to add? No? Okay, well, I just want to thank everyone for attending today's webinar. A big thank you to Lesley, Rob, and Michael for a great presentation. As mentioned earlier, it has been recorded and will be available to those who are attending today and also those who weren't able to attend. I'd like to thank you all for participating in today's session, as well as the support that we had from our events team behind the scenes. And last but not least, follow up to today's session, you'll be receiving a brief anonymous survey, and we'd be really thankful if you could take a few moments to complete it, as your feedback's extremely helpful and also gives us ideas for where to move in the future for other presenters or topic areas. So thanks again to everyone, and I hope you all have a great day.